Now I would like to introduce. I don't think he needs introduction. So, Mr. Sardar Nasir Ali Khan is one of Srinagar's first RJs and continues to be one of the most beloved air voices on air. And he has become one of the most influential voices. And as an RJ, he understands his work is to keep people informed and entertained, but at the same time ensure that level of decorum is to be maintained. He has also been a part of anti-drug addiction and other campaigns, and he has actively been raising awareness about various issues in Kashmir. So, Mr. Nasir, please, if you could share your
Uh,
insights with us.
Thank you so much for that kind introduction, and my greetings to everyone who is present here right now and who is listening, who is watching. Thank you so much for the opportunity to speak in front of all of you. It's always a pleasure to be a part of such a discussion where things are being discussed which are pertaining to today's world, and mental health being one of the most important things we should all talk about, be it on radio, TV, social media, or maybe in gatherings with friends and family. I think it should be the right time that we take it very seriously and we talk about it. So my topic of discussion is talking about COVID, coping up with COVID, talking about mental health and all the other issues. I think in 2020, when this happened, it was absolutely new for all of us. We had no idea that what we are dealing with. And to be very honest, like all of you, we thought that it will be over in a month or maybe 15 to 20 days, a month max. But it kept on stretching, it kept on stretching, and then we got the figures from different countries, different states that unfortunately people are dying. And the most tragic thing was that people were dying because of the want of oxygen. So how you would tackle that? How as a broadcaster you would take this news on radio? How you would talk to people? How you would disseminate all the information which you have from different sources, and you would give this information to people? I think our work was, we were like walking on a thin line because we had no idea what we were dealing with. And in those times when COVID hit initially, you would see that everyone, be it newsrooms, Facebook, social media, Twitter, or maybe on radio also, people started to become self-proclaimed, you know, uh, self-proclaimed people who thought that if you do this, it will run away. If you do this, you're being saved from COVID. If you do this, this will happen. So gathering information from the right source at the time when it was peak COVID was very important, and that's what we did. We had to do a lot of filtering while we were doing radio, and in those times we had to do a lot of filtering about what to say on radio, how to break the news that how many people are affected with COVID, how to talk about how many people have unfortunately died with COVID, how many are battling for their lives. And if we talk about situation here in Kashmir, we know that even if there is anything negative which is happening, people push the panic button. So one had to be very careful in that regard also, that if there is any kind of information you would want to you would want that information to reach out to people, how you would do that. So as a broadcaster, for me also, it was a very emotionally taxing time. It was a learning curve for me also. Now that just imagine the fact that all my parents here, both of them are in their mid 70s, both of them are uh, they are insulin dependent. They are the ones who take insulin injections daily, diabetic, peak diabetic patients. And then you hear the news that COVID is a virus which primarily attacks the people who are diabetes. So how would I cope up with it? I am someone who used to go out, who used to meet people, who used to plan things. We used to mobilize a lot of resource. We used to try to make sure that people get masks, sanitizers, oxygen cylinders. But then I thought that I have to think about my parents also. So then came a point where I left going out of my house. And this happened when the second wave hit, because it was very aggressive. People were falling ill, the hospitals were running high with patients, people had no idea what to do. So I left going out of my house. And I think for a period of 2 months, I was just confined indoors. And what it did to me, it really played on my mental health. And this was the only thing which used to be on my mind. that if I go out, I'll get the virus home. If I do this, I'll get the virus home. To a point that I became paranoid with this. And I think it's the right time to talk about it, that I have few friends who are mental health specialists, and I did call them up and I did seek help from them, that this is what is happening to me. And here you're talking about someone who people think that, he is a happy-go-lucky guy. He has a wonderful job in the world, cannot be affected with anything. But here I was losing my sleep just because of the fact that COVID was, rampant everywhere. Just because of the fact that my parents are old. Just because of the fact that what if I get it, and because of me, my parents will get it, and also my family members. So this did play a very, it had an impact on my mental health, to a point where I thought that I should leave my job and I should sit at home and I should just relax, not talk about it. So then I took a decision, took a break from my job in August last year, and then finally coped up with whatever was happening around and gathered myself and then started fresh again. So the point of saying this is key. Uh, for us broadcasters, it was very difficult to talk about COVID because, in radio, if we particularly talk about FM radio stations, there is a theme which people think that the radio stations follow, is that, they bring cheer on the faces of people. How would we talk about deaths, and how would we talk about the number of growing COVID cases which were happening every day? So we started to shift base from actual stuff which was happening, and then we started talking about lighter things on radio, like lockdown is there, so what are you doing in the lockdown? So lockdown is there, which song would you want to listen to in lockdown? Which song would you want to dedicate to lockdown? So I asked people to call me up and share their lockdown stories with me, and I was so happy to know that people took up many hobbies. uh, a lot of my friends who thought that they did not have a particular inkling towards something, they started painting, they started doing videos on social media, they started writing, they started singing, they started spending time with family. And I think what COVID did, and a lot of people shared that fact with me on radio, was that COVID brought a lot of people together, especially parents and kids. This bond, I think, got a little bit stronger because parents had a lot of time at their hand. They sat with their kids. They had an idea what the child was doing, and also because of the fact that the bonding was there. uh, we always hear that the family which eats together stays together and prays together, right? So that also started to happen. So all these things, I as a radio broadcaster started to notice on my shows, because people used to call and then they used to tell ki aaj humne ye kiya, aaj humne ye kiya, aaj humne ye kiya. So it was kind of a amazing learning experience for me also as a radio host, where I went through certain challenges in my life also, and also as a broadcaster, where what I should say on radio and how I should give the information. And then there came a point that I noticed that a lot of people, a lot of media houses were only circulating news about how many people got affected with COVID, how many people died, in how many districts the COVID number was this. So what I did, I started saying that these many people were cured of COVID. These many people were cured of COVID in following districts. It was all about spreading positivity on radio, and in all that, yes, it did affect me also in a negative way. But then, thankfully, because of my friends who are counselors, I came out of it. And I think I'm sharing this story here because we are talking about mental health, and we are talking about things we should now uh, should not keep under blanket. We should talk about that. When I was vocal about it, everyone else can. Yeah.
Thank you so much, Nasir. I think the fact that you brought out your own personal story about how COVID affected you, I mean, brings point a very important point that people like you, everybody doesn't expect, would be somebody who would be affected so drastically because of
Yeah.
this. You like, most of the times it's like you will be responsible to bring cheer to other people, but being yourself so affected by it is something that anybody, so that means that anyone can be affected by, because the magnitude of COVID was such that it deeply affected each one of us in different ways. Thank you
I
so
think the
much for
most
bringing.
important thing, I'm sorry to interrupt you, the most important thing here is to learn that we should always know that it is very important to give yourself a lot of time. What happens is that we give so much selflessly that we forget that it is our own well-being also which is important to us. So that needs to be taken care of. You should give yourself a lot of time. You should retrospect about the situation. You should think about a lot of things which bother you, and definitely the most important thing which will always come out of any discussion when we talk about mental health is that we should always talk about it. We should always talk about it. We should never keep it under wraps. We should talk about it.
Right, and I think that's the most important point even we are trying to make through this event is that we need to talk about the mental health issues and we need to discuss it with people to actually get some. Thank you so much, Nasir.